Dr. Verma, I wasn't sure I understood your answer to Senator Moody a moment ago. Do you think that men can get pregnant?
I hesitated there because I wasn't sure where the conversation was going or what the goal was. I mean, I do take care of patients with different identities. I take care of many women. I take care of people with different identities. And so that's where I paused. I think, I wasn't sure where you were going with that.
Well, the goal is just the truth. So can men get pregnant?
Again, the reason I paused there is I'm not really.
We are so cooked. Good day, everybody. Welcome to the channel. I'm Ty Smith. You watch my channel, Model Renaissance Man, and I thank you for that. Make sure you guys are following me up on these platforms and the platforms that you see down here. Click the thumbs up button right now because it really does help get my channel information out. If and when you do subscribe to the channel, don't forget to click the bell notification. That way you'll be notified when I post videos like this. And lastly, go check out my other channel called Man Husband's Father. Go subscribe to it because it's all about being a man, being a husband, being a father, and in that order, it's for everybody. You don't have to worry about no differences of political blah, 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 blah. Okay? Thank you. Y'all saw the beginning of this, what I put up there, y'all, and oh my God, I cannot believe this is where we are right now. I cannot believe it. It's actually pretty sad, especially for my fellow medical professionals, that we have to, you see this. Like everything is going to be a joke, but I can tell you this right now before I even get into this video, everything in the end, when you see what you're about to see right now, and you have doctors, other medical professionals, when you have us up here and you can see that we clearly are lying, understand the line is not just for the sake of lying. The line is for the benefits of the medical community. See, you want to defend, I'm not saying me, you want to defend this nonsense that y'all are about to hear. Why? Because it keeps these people coming through the door, because it keeps them on mental health medication. It keeps them on gender affirmation surgical medication. It keeps them on hormonal medication for the rest of their lives. It's all about that money. Keep that in mind while you listen to this. As medical professionals, as doctors, as PAs, as therapists, as nurses, CNAs, nurse anesthetists, nurse practitioners, as these medical professionals, we know the truth. All of us get a file when you come and see us, or, now everything is computerized. When we open the file up and we look in your chart, it will say patient is a 63-year-old male or patient is a 63-year-old female who presents with da-da-da-da-da-da-da-da-da-da-da-da-da-da. There has not been one person ever in history as a biological, you know what? Let's get to the video because this is just ridiculous.
Dr. Verma, I wasn't sure I understood your answer to Senator Moody a moment ago. Do you think that men can get pregnant?
I hesitated there because I wasn't sure where the conversation was going or what the goal was. I mean, I do take care of patients with different identities. I take care of many women. I take care of people with different identities. And so that's where I paused. I think, I wasn't sure where you were going with that.
Well, the goal is just the truth. So can men get pregnant?
Again, the reason I paused there is I'm not really sure what the goal of the question.
The goal is just to establish a biological reality. You just said a moment ago that science and evidence should control, not politics. Absolutely. So let's just test that proposition. Can men get pregnant?
I take care of people with many identities, but
can men get pregnant?
Many women that can get pregnant. I do take care of people that don't identify as women. That
can men get pregnant?
Again, as I'm saying,
let me just remind you what you testified to a moment ago. Science and evidence should control, not politics.
And those of us that go to school for this, knowing that we are heavily educated in science, we have to go to labs and do demonstrations. We have to have cadavers. You have to perform surgeries on people who donated their bodies to science. Half the body, I'm just telling y'all, half the body from the hips down. Depends on what it is that you're doing. From the hips down to the knees, if you're doing hip replacement, you have to practice on this. There's things that tell us that we have muscles, we have bodily tissues, we have blood vessels, we have blood, period. Breaking that down to cells and things, what these different cells do within the body. It's biological science, anatomy and physiology, microbiology, cytology. What in the world? So she says she don't want to politicize it, but the fact that she's answering the way that she is, she's literally going off of a political agenda already from the jump. Answering simple truths biologically does not put you on the left or put you on the right. It's just telling the truth. Are you sitting in the chair? Yes or no? Yes. That's it. Well, I don't want to politicize it because sitting to me may not be sitting to you. Come on, man.
So can men get pregnant? You're a doctor, I
agree.
think.
Science and evidence should guide medicine.
Do science and evidence tell us that men can get pregnant? Biological men, can they get pregnant?
I also think yes, no questions like this are a political tool. And
No, yes, no questions are about the truth, doctor.
Doctor, what color is your shirt?
Doctor, let's not make a mockery of this proceeding. This is about science and evidence, and I'm asking you, the United States Supreme Court just heard arguments yesterday at great length on this question. This is not a hypothetical question. This is not theoretical. It affects real people in their real lives. And you're here as an expert, called by the other side as an expert, and you've been telling us that you follow, right, you're a doctor, and you follow the science and the evidence. So I just want to know, based on the science, can men get pregnant? That's a yes or no question. It really is, I think.
I think you're trying to reduce the complexity of a lot.
I'm not. I'm trying to get, it's not complex.
Biology is not complex. Depends on, it's not complex. You die, we would know what type of person you are. Like we had to sit there and look at people. You had to look at different skeletal remains, right? And looking at the size of the hips and the angle of the hips and know if it's a male or a female.
I'm trying to get to an answer, and I'm trying to test, frankly, your veracity as a medical professional and as a scientist. Can men get pregnant?
I think you're also conflating
This is
male
extraordinary.
female with
No, I'm not conflating male and female. They're two different things. There's biological men and there's biological women. And I want to know, can men get pregnant?
What you were talking about is biological.
You're not going to answer my question, it sounds like.
Biological males.
This isn't hard, doctor. Can men get pregnant? Yes or no?
This is crazy.
I would be more than happy to have a conversation with you.
I told y'all, when I go to these speaking events, I told y'all there are those of us that's in medicine, right? There are those of us that have common sense. Just tell you there's no agenda. We just there to help. We doing our thing. You come in with a broken, I'm ortho, so my thing is sports medicine and orthopedics, right? Well, now I'm a director now. So anyway, my point is this. You come in and you're hurting. If you have an x-ray and I see that you have some sort of fracture, I'm going to tell you, you broke your bone. Well, what is a bone? Maybe what you define. What is happening? But then I told y'all we got people that's in medicine that are completely Looney Tunes. And you're seeing it right now. That is embarrassing. That is, you know what? That is embarrassing. But at the same time, I told you in the beginning, I understand the agenda. I know it's all to get the patients to come through that door, to be confused, to not know what's going on, to go along with this agenda that she's talking about right now. Notice I said what she's talking about right now, because getting anybody on any sort of pharmaceuticals, medicines, yada, yada, peanut butter, it keeps the money flowing in, and you will be a forever crackhead to doctors. Period.
That is not coming from a place of trying to be polarized and push.
I'm not trying to be polarizing. I'm trying to ask, I think it is extraordinary that we are here in a hearing about science and about women. And for the record, it's women who get pregnant, not men.
And anyone that's seeing this doctor as a patient, if you cannot have her flat out tell you what you are, don't you think that's an issue? If she cannot sit there and tell you the truth, could she be lying about other things? How do you know you even pregnant? How's that? Because what? And she's OBGYN. When she goes and do like a pap smear on you, what is she doing a pap smear to? Is that your cervix? Well, oh, wait a minute. No, you don't have a cervix. Because you know what I'm saying? It's so stupid.
We are here about the safety of women and science that shows that this abortion drug causes adverse health events in 11% of cases. That's 22 times greater than the FDA label. Another fact you haven't acknowledged, and yet you won't even acknowledge the basic reality that biological men don't get pregnant. There's a difference between biological men and biological women. I don't know how we can take you seriously and your claims to be a person of science if you won't level with this on this basic issue. I thought we were past all of this, frankly. I can't believe we're still here talking about this.
I am a person of science. And
No, you're not. No, you're not. No, you are not. You're not. You know exactly what you are doing. Me and other medical professionals, we all know exactly what you're doing and why you are doing it. Plain and simple. You know.
I'm also someone here who's here to represent the complex experiences of my patients. And I don't think polarized language or questions.
That's projecting. Now, nobody's polarizing, just asking the question, can biological men get pregnant? That's it. No, they can't. They can't.
Questions serve that goal. I don't think they serve the American people.
It is not polarizing to say that there is a scientific difference between men and women. And I want this to be clear and for the record. It is not polarizing to say that women are a biological reality and should be treated and protected as such. That is not polarizing. That is truth. It is also, by the way, the United States Constitution, which offers unique protections to women in a variety of circumstances as women. And your refusal to recognize women as women and men as men is deeply corrosive to science, to public trust, and yes, to constitutional protections for women as women. And I think it's extraordinary that you would sit here and advance a political agenda that has been thoroughly discredited and rejected by the American people in this forum. And I'm glad we had this exchange because it is exceptionally clarifying. It is also in many ways quite depressing. I see that my time has nearly expired. I just want to thank the other witnesses for being here. Thank you for protecting women and children. Thank you for your valiant efforts. Thank you for following the science.
That's sad, man. That is absolutely sad. And guys, like I told y'all, I know that we will look at this and say that woman is stupid, that woman is crazy, da-da-da-da-da. She's crazy for playing into the agenda, but she knows exactly what she's doing. And I'm not going to say y'all names. Y'all, all the docs that watch my channel, you guys know exactly what I'm talking about. You know that is a revolving door, and it's all to be crafty. It's all to be sneaky because we do not care. How do you really know a patient is really sick? If I came into the hospital, if you came into the hospital, right? If I went to the hospital, anybody go to the hospital and you say, man, I've been having this, I've been having that. Sometimes when I burp, it comes up in my throat. You know that the doctors don't care whether you're telling the truth or not because the brain is already moving what you're getting ready to get you put on. We're getting ready to put them, those GG codes and all. We getting ready to put those codes in there to charge your insurance. Whether you are sick or not, they don't care. It's money. Well, let me tell you now, you do got some honest, real doctors. I'm just keeping it real, y'all. There's honest, real doctors out there that will, well, let me check this out. Let me see this where your blood levels look good. So I don't understand why you having this. There are doctors that would do, but there's others that will just take you right in and just take you right at your word and do it. You go in and feel like you a woman, you want to get your ding-a-ling cut off and fold it inside out and shove back up there. You want to use your balls, skin, as a fake labia, the fake vaginal lips. I'm just going to say they're making lamest for y'all. You want to do that? Okay. If you want to get your vagina and everything in your womanhood sucked out, whatever like that, and give you a prosthetic penis because you feel like you're a man, okay, we'll do that. We're going to put you on these hormone pills and da-da-da. You're going to take it for the rest of your life. But although it's going to increase your self-deletion rates extremely, it doesn't matter. That's crazy to me. She OBGYN talking about come on now. What are the babies being birthed out of? What do they come out of? That's not a uterus. It's not a uterus. It's an enlarged prostate. Come on. Anyway, y'all, I'm done with this. Thoughts? Put them down below. Don't forget to do what y'all see in the animation right here to greatly help my channel. Next video I will do after this one in chronological order is up there. Things I did as of yesterday may have missed right here. If you have not subscribed, click that icon. I am Ty Smith, Model Renaissance Man, and I hope and pray that every last one of you have food, shelter, and clothing. Most of all, praying every last one of you guys are in great health mentally, physically, emotionally, spiritually. God bless you all through Jesus.